Mental health wellness in the town of Garner. Welcome to Garner, North Carolina. This is a town which was chartered in 1905. It is a small town and suburb of Raleigh, North Carolina, in central North Carolina, and it is the hometown of Scotty McCreery. So, for our community health assessment, we completed an assessment on the town of Garner with an emphasis placed on mental health. During our assessment, we used a windshield survey, a secondary analysis, and an informant interview. Here's some demographic information on Garner. Garner is 91% English speaking and 6% of the people speak Spanish. Also in Garner, 59% of people are married. It's a pretty family oriented community from what we could see. Persons living below the poverty level in Garner are 3.9%. Also, the percentage of persons 25 years and over in Garner are with a high school diploma are 89.3%. A bachelor's degree or higher is 32.6%. 58% of people in Garner are Caucasian, 33% are African American, and 10% are Hispanic. Here's a little bit of background information in Garner. Garner originated as a stop station for the railroad in 1847. Once the town acquired a railroad depot, it was reincorporated into the town of Garner in 1905. This picture is actually taken of the old depot station in downtown Garner. Downtown Garner also has a lot of parks, recreation facilities, a senior center, and a performing arts center to offer to the community. For the sake of brevity, we will not be showing our videos in this presentation. However, we highly encourage you to look at our windshield survey videos once the presentation is over. That way you can get a better understanding of what kind of town Garner is. So here's a chart of the cost of living index with more information on the next slide. So the cost of living in Garner is 1.7% greater than the North Carolina average. However, the cost of living is also 1.6% less than the national average. Housing in Garner is actually kind of getting a little bit more expensive as Garner increases in popularity. 67.5% of homes are now owner-occupied and 32.5% are renter-occupied. Most homes are within neighborhood subdivisions. However, Garner also has a substantial amount of farming land. The median home price in Garner is $168,300 with a median home value of 9.6% greater than the North Carolina average. Here's a better chart of all the averages for housing. One of our classmates went to a community program in Garner. It's actually the Herbalife community program, which is a weight loss and exercise group that is offered in the community. It's just an example of how Garner has a lot of different resources for people to get out, stay active, and be healthy, and just be a part of the community and interact with others. This particular Herbalife group that Rosalind went to actually had most people be of Hispanic origin. A lot of them talked about how, they lost more weight while they were in a group, how they were just healthier individuals because of the group that they were in. Garner has not too much crime compared to the North Carolina average, but it's still present, obviously. Okay, now that we have introduced the town, it's time to focus on the state of mental health and access to mental health services within Garner, North Carolina. So first of all, with our informant interview, we asked them a bunch of questions, and they provided us with the following information. It was actually a travel nurse who's been working in the North Carolina Central Prison for over a year. So she deals with a great deal with the mentally ill in the Wake County area. She stated that Central Prison serves as the admission point into prison for adult male felons sentenced to 20 years or more, and it is the main medical and mental health center for male inmates. The North Carolina Division of Prisons has the responsibility to deliver comprehensive mental health services which provide for the care and treatment of inmates with mental disorders. Treatment programs will contain multidisciplinary services designed to prevent, control, reduce, or eliminate those conditions which contribute to the inmate's mental impairment. Major health conditions seen in this community are hypertension, diabetes, and obesity. Furthermore, most patients end up in the emergency department seeking care versus quality mental health facility care. There is a facility in Garner called Living Well Behavioral Health. This facility helps alleviate depression, nightmares, mania, hyperactivity, anxiety, etc. At Central Prison, they are currently expanding the mental health department due to the closing of the psychiatric hospital Dorothea Dix in 2012. The Garner Chamber of Commerce, furthermore, is a nonprofit organization who advocates Garner economic vitality and serves the community as a resource center. So, access to healthcare in general in Garner used to be hard to come by. Besides urgent care centers, all they had, like, they didn't really have anything until 2 years ago. The Wake Med Emergency Department in Garner opened up, and it kind of has become the main place where a lot of patients with mental health issues will go now when they're feeling ill. Um, the community of Garner ranked the top 5 health issues as obesity, followed by mental health, injuries, diabetes, and teen pregnancy. So obviously, mental health is pretty high up on the list for issues in health in Garner, North Carolina. Um, in recent years, North Carolina has suffered a major blow to its mental health system. A lot of us have heard about the closing of Dorothea Dix Hospital in 2012. Unfortunately, many patients are now left with few options when it comes to receiving adequate mental health care. A community health survey of Wake County, the county in which Garner resides, revealed the following information. Dwindling funds for public mental health services and the continuing loss of beds at Dorothea Dix Hospital will place a greater burden on policing services, which we can already see by our overwhelming amount of mental health patients in emergency departments. There has been a significant increase in the number of state mental retardation center admission requests and subsequent, as well as reliance on psychiatric hospitals and law enforcement. Maladaptive behaviors left unaddressed for long periods of time are far more intractable and eventually require for more restrictive and costly interventions. According to the Wake County Community Assessment Survey, of the 1,349 individuals surveyed, 60% reported they would not know who to contact or call if a friend or family member needed counseling for a mental health problem. Family systems are strained from economic impacts and are leading to caregiver under or unemployment, mental health, substance abuse issues, family disintegration, and child/adult abuse and neglect. So, how can Garner and Wake County reach those from different cultures? A lot of times we don't actually consider the different cultures that are around our communities, and people of Hispanic origin, or an Asian culture. They suffer from mental health issues as well, and sometimes we don't have enough resources to provide for them. Garner, unfortunately, doesn't have many behavioral health facilities. However, Wake County does serve Garner, and Garner actually can send patients from the emergency department to a variety of different facilities. Alliance Behavioral Health Care is just one example of a facility within Wake County that practices cultural competence. They have a very good cultural competence profile listed on their website, and things they will use for helping patients with cultural and language barriers are, they will use translation services, video chat translation programs. They will provide written materials in patients' native languages, and they also have cultural awareness programs and practices that they use throughout their facility. And WakeMed, the facility that I work at, actually has a cultural awareness program as well. So that helps members, workers at WakeMed learn cultural competence. So for our community diagnoses and strengths, we decided that healthcare comes down to access, affordability, and outcomes. Garner residents have access to 4 acute care hospitals within 60 miles, which is pretty good. Garner residents are in Wake County, and the county ranks first for health outcomes, second for health factors, and second for healthy behaviors in North Carolina. Residents spend 7.4% less than the national average on healthcare-related goods and services. The Garner Chamber of Commerce is a nonprofit organization who advocates Garner economic vitality and serves the community as a resource center. A variety of support groups are available within Wake County and Garner, such as NAMI, the National Alliance on Mental Health Illness chapter for Wake County. And Garner recently gained a new behavioral health facility called Strategic Behavioral Health, which benefits children and adolescents in the community. Some weaknesses that we saw for Garner were that Garner does not have enough mental health facilities to treat the rising number of individuals with mental health needs. Many individuals do not know how to access care, especially mental health services. Furthermore, basic needs of individuals with mental health issues, such as housing, are not being met. There's a lot of people that are homeless with mental health issues in the Garner area. Primary prevention for mental health we recognize as being, introducing programs in schools which help children learn good coping mechanisms, provide counseling services for children within schools, drug use prevention programs such as the DARE program in schools would be helpful. Town and community offer programs which teach residents how to recognize early signs of depression, anxiety, or other behavioral health problems would be a really good primary prevention for mental health. An implementation of crisis prevention hotlines would also help people, get their problems sorted out before they get any worse. There's also a lot of walks every year, such as the NAMI walk for behavioral health that people can participate in. Secondary health interventions would be providing mental testing for those with existing conditions, educating the public on the importance of compliance with all prescribed psychiatric medications, and educating people with mental health issues on the importance of attending all scheduled appointments. Tertiary health interventions would be, providing access to community-based support groups for people with mental health disorders, such as, Alcoholics Anonymous, support groups for those with depression, bipolar disorder, anxiety, and support groups for those who are grieving. Rehabilitation would also be an important part for these patients that are suffering from mental health issues. Another problem is that we don't have enough facilities for the patients in Garner, so access to mental health facilities for patients like Dorothea Dix Hospital, which recently closed down, Holly Hill Hospital, or Strategic Behavioral Health would be beneficial tertiary intervention. So what have we learned? Most of us learned that, there's not enough mental health access within Garner or Wake County, especially since Dorothea Dix was closed down. It's very unfortunate that these patients can't get the help that they need. They have very limited resources, and because of that, they're just overflowing in our emergency departments, and they're just not getting the health care that they require. We did learn that Garner is a very friendly community, and it has a lot of uh, recreation and stuff, but as far as like reaching people in a health related way, it's just kind of lacking. So in conclusion, Garner, North Carolina is an area that is full of activities and services for its residents. Wellness is promoted by community centers and other community-based programs. However, mental health is still a large problem for Garner residents and filters into other problems such as increased crime. While Garner has many wonderful aspects, the increasing need for mental health services that is caused by a growing population is not being met. References, yay! Thank you for listening to our presentation, and please make sure to watch our videos once this is done. Thank you.